Daniel Ross. I'm the president of Hawaii Nurses Association. Today we're doing an informational picket to bring attention to the nurses at Queens North Hawaii Community Hospital, who, although they still work for Queens Systems, are paid 20% less than the nurses in Honolulu. They get no pension, they pay more for their insurance benefits, they get a lesser 401k match. So they have a hard time getting enough nurses to work here. And it's one of the main reasons is they don't pay them enough. And we're trying to get Queens to at least treat them equal to the nurses on Oahu. We stopped negotiations last week. The contract ended. We're currently working without a contract. The management asked if we would go into mediation, and we agreed. And so tomorrow we'll have our first session with the FMCS, the federal mediator. All we're asking for is equity with the Oahu nurses. There's no reason why people on the Big Island are worth less than people on Oahu. We make a fairly good wage, but with the cost of living, we're the lowest throughout the nation. So I can have a higher standard of living anywhere in the nation working as an RN than I can in Hawaii. Even though we make a decent hourly wage, the cost of living is so much higher than it is elsewhere in the nation. We're not striking. We're bringing this is for attention. This is to get some publicity so that people know what's going on, and we're asking the community to support the nurses out here in Waimea. There's a term that's come into use in the last few years called moral injury. They used to call it burnout. And the more accurate term is moral injury, because it affects people when you know you can't do as good a job as you should, just because you don't have the staff and the resources to do it. So you have to prioritize to do what needs to get done. And you know that the patients deserve better, but you do not have the resources to do it. And so that causes psychological issues, which is known as moral injury.
My name is Libby Joyce, and I'm a nurse on the medical surgical floor. The entire time that I have been here, low staffing, understaffing has always been an issue. It's literally a concern every day before every one of us nurses goes to work. What's it going to be like today? There's really nothing that administration has said to justify this in any way. They've said they have the money. They just shrug and turn the other way as far as we can see. We're just hoping that this event today opens their eyes a little bit.